When I first met Henry's mom, Maria, her only options from her doctor were medications or tube surgery. She was not on board with that and was determined to find a natural ear infection remedy that would be an effective option to hold off surgery as well as to get to the root cause of Henry's chronic ear infections. She hoped this would stop the seemingly endless cycle of pain, sleepless nights, and antibiotics that she knew were wreaking havoc on his gut and immune system long term. Because of this, Maria reached out to our office. And here was the good news. We were able to share with Maria and now parents seeing this video that natural remedies for ear infections do exist. These natural remedies have been around for a long time and they help provide pain relief, reduce inflammation, and promote drainage and work to not just help a child get past an acute ear infection, but prevent future ones as well. In order to best understand the role that natural remedies for ear infections play, we first have to understand the root causes of ear infections in the first place. And that all starts with what we call the plumbing or drainage of the inner ear, and then the signaling and communication of the central nervous system, the brain and body's immune system. And when Maria first found us, she shared with us that we have been on antibiotic after antibiotic for multiple ear infections and now have been referred to the ENT for tubes and also tonsil and adenoid removal, which makes us uncomfortable as parents. And she knew there has to be something else to try before we go the surgery route. The number one issue that really causes ear infections in the first place is the buildup of fluid. The entire ENT, respiratory, and lymphatic system work just like the plumbing in your house, in that it's all linked together. So, not only do the nerves and muscles of the inner ear need to be working well and moving fluid along, but it's got to keep moving through the neck, lymphatic system, and throughout the whole body. Put simply, if the body cannot expel the viruses and bacteria, it becomes chronically congested with them, leading to ongoing inflammation and recurrent ear infections and other illnesses. Therefore, any natural ear infection remedy, it must first address the poor drainage and get things moving. Just like a clogged drain in your home can cause the fluid and the buildup of junk and crud. It's honestly the same thing that's happening in your child's inner ear. Unfortunately, the natural remedies you'll learn about in this video are not the kind of information really that you'll be told about by your standard pediatrician or ENT's office. And while many years ago the AAP and the CDC they did finally approve a watch and wait guideline for ear infections, and reviewing this two-page document on the CDC's website is equal parts encouraging since they recommend at least 2 to 3 days of watch and wait before antibiotics, but it's also really discouraging since the only thing they recommend for treatment without antibiotics is ibuprofen, acetaminophen, fluids, and rest. And just like every single medication out there, ibuprofen and acetaminophen, they come with plenty of risks themselves, weakening the immune system over time. But what's really exciting for parents is this: these natural remedies that we're going to discuss, they've been around for years and have helped countless kids stop the endless cycle of ear infections, antibiotics, and ear tube surgeries. So while the short list of natural remedies, it can include things like warm or cold compresses, rest, vitamin D, um, distracting them from their ache, pain, discomfort, salt water, hydrogen peroxide, ginger, naturopathic eardrops, or changing sleep positions. Most parents, they've tried these, and while they may help at the moment, if the ear infections and continue to persist, we need to look deeper at what can be done to address the cause. So I want to dig into neurologically focused chiropractic care and how it can be key for not only drainage, but the signaling and communication of the entire immune system. Finding that root cause begins with a deep dive in your child's case history, And here's what we continuously find in children struggling with ear infections, that there was something related to one of these challenges or multiple of these stressors early in life. And one of them being birth interventions and traumas, such as forceps or vacuum or induction or C-section delivery, a tougher labor and delivery. It can be a health challenge early as an infant, like colic, reflux, or constipation, or an early exposure to antibiotics or a steroid based medication. And it might even be a diet that's high in sugar or processed foods, dairy, grains, gluten. Each one of those early stressors increases the tension and stress on the nervous system, leaving it stuck in a more sustained sympathetic fight or flight response. And that sustained sympathetic and subluxation then increases the tone and tension of all of the soft tissues and muscles of the upper neck, including the tiny muscle, the tensor veli palatini muscle, which then gets too tight and wound up and limits proper drainage of the eustachian tube. Additionally, sustained sympathetic tone creates a challenge or condition called dysautonomia, which leaves the body in a more inflammatory state and weakens the immune system as a whole. This leaves the ears and the immune system facing two problems: unable to fully drain the fluid from the ears and in a pro inflammatory or weakened immune state. But the good news is chiropractic adjustments help with both. Neurologically focused chiropractic has been shown to have an incredible impact not only on the prevention of ear infections, but on helping kids get better when the ear infection is the worst. So, in retrospective studies, 93% of kids with acute ear infections improved after chiropractic care. So when Maria, Henry's mom, first found neurologically focused chiropractic care, she truthfully wasn't exactly sure how long it would take or what exactly his care plan would be focused on. But after our initial consultation and hearing our clinical process, she knew she was in the right place. And after deep diving into Henry's history, we found he had a difficult birth and delivery. He snored when he slept, and he had a very weakened immune system from a young age. Next, Henry's insight scans showed that he had extra tension in his upper cervical spine, the neck region, right around where the muscles that help drainage from the sinuses into the neck's lymph node. This was holding fluid where it shouldn't be. Putting his clinical history and his scan findings together, we built out a care plan specifically for him. And after just a few months, he was entirely in the clear from ear infections and on the path to healthy, thriving childhood. When we guided Maria through Henry's insight scans at our report of findings visit, it was eye opening to see the exact area the struggle was coming from. And here's what Henry's scans look like to start, along with the amazing progress throughout his care plan. So the insight scans, they really show Henry's amazing progress. And this is an EMG scan that looks at the energy and tension in the muscles of the neck and the whole body, but the neck specifically, that helps drain the inner ear and keep fluid moving through the neck, through the lymphatic system, and through the entire body. So in Henry's before scan, right over here, in this before scan, you can see the red color in the neck and the upper back. So C1 to C5, that area, this showed so much tightness and tension, holding back the full drainage of the system from working properly. It was simply getting stuck in his ear canal. But in Henry's progress scan, the tension was drastically reduced, going right along with mom reporting that he was no longer congested, clogged, and filled with fluid in the ears, the nose, the throat. So you can see how all that redness, that excess tone and tension was coming off his system, giving mom that full confidence that his body was draining by allowing that tone and tension to calm down. Proper drainage of fluid from the sinuses is allowed to happen. Better movement, looking left to right for continued lymph drainage down the system, what ultimately leads to less buildup of pressure in the ear, making clogged ears and sinuses a thing of the past for Henry. Yes, neurologically focused chiropractic care may not be on every Google search result, but it still has proven very effective in helping children get past the cycle of chronic ear infections and chronic antibiotic use. So, if after hearing Henry's story and learning about neurologically focused pediatric chiropractic care, you think that subluxation or increased tone and tension may be playing a role in your child's chronic ear infections, we would love to help. And as always, eh, we so appreciate y'all for sticking with us in this video. We love to share as much information as possible so that you and your child can conquer their health challenges. So I look forward to talking with you all in our next video. God bless.